Hi everybody, today I'm going to be talking about my birth plan. I know some people don't really believe in a birth plan while other people do really appreciate having a birth plan. My birth plan is something I filled out online with my hospital. I did not make this stuff up myself. They were questions that the hospital asked me and I needed to log into the hospital website and just fill out the birth plan so that they knew what I wanted. Now ideally I know that most people make their birth plan and it does not go that way. Births rarely ever go as planned. So I'm completely aware of that. However, I do have some medical issues that need to be addressed in my birth plan, and I will go over that a little bit later. So the first part of my birth plan is the environment, and there were two questions on here. The first one was, I would like the following people to be present at birth. Now, it's not necessarily for me that all these people need to be there for the birth, but the people that I put on here have special visiting privileges, whether they want to be in the room for the birth or not. Now, of course, Danny, my husband, will be there, and my mom and his mother will be there as well. But additionally, on top of those three people, they also let me put on my dad and my sister, and they would just have special visiting privileges. I don't necessarily know that either one of them, especially my dad, does not want to be in the delivery room at the time, but I wanted to make sure that they were available to come in and out whenever they pleased. So it did let me choose my husband and up to 4 other people, which to me seems really crazy. I have already been in the hospital because we kind of had a pregnancy scare, so I know how big the delivery room is, and to have 5 people in that room with nurses and doctors is probably not even feasible. Like, it probably just can't even happen. The second option was I would like to bring music or CDs or a mini stereo, and I just put yes. For the stages of labor, and this is going from 0 to 10 centimeters, the first option was I would like to stay hydrated by using ice chips. I put yes. There's nothing else that they will offer me or that they can offer me, I guess. You know, that's really the only thing that they will let me have, so I wasn't going to put no and then just not be able to have the ice chips if I want them. I can always say no, I don't want them later if I don't want them. In order to allow more freedom of movement, I would prefer to have an IV access instead of being connected to a continuous infusion. My birth partner and I would like to take a few moments privately to discuss my pain relief options before the decision is made. Now, this is kind of where some of my medical history comes into play. My birth plan says ideally I'd like a drug-free birth, only offer medication if I ask. Now, ideally on top of that, I did not necessarily want to go into this having a medication-free birth. You know, having a natural birth is great, fantastic if you can do it. That wasn't necessarily what my plan is. If, you know, I could try it, but I know a lot of people go in saying, hey, I'm going to have a natural birth, and they end up getting medications, you know, at 5-6 centimeters or so. I mean, it really hurts. So to me, going in and saying I'm definitely having a natural birth was kind of a little ridiculous. However, the case with this is I have pretty severe reactions to some medications, and I also have scoliosis. So the doctors have told me that an epidural is absolutely the last option I can have, if I can even have it at all. So really, I kind of have to throw all spinals out the window. I can't have them. Then the medications that they would give me, I've never been tested for, I've never had them, and we don't know if I'm going to react to them. So those would only be offered to me if I absolutely need some sort of pain relief. And they would be administered through an IV, and that could affect the baby. So really right now it's just fear over pain. Is my fear of getting these medications, having the reaction, and possibly affecting the baby worse than the amount of pain that I'm in? And I don't know yet. I would hope that the fear is worse than the pain, but from what I hear, that's probably not going to be the case. I would like the opportunity to try the following non-medical pain relief methods. And I put walking, aromatherapy, music, breathing and distractions, pillows, birthing ball, position changes, hot and cold therapy, relaxation, imagery, rocking chair, massage, shower, and a soft tub. From my understanding, they do not have a birthing tub. The room that I was in only had a shower. It did not have a tub, so I'm not sure how many of these things can actually happen. The only option I didn't select was standing during delivery. To me, that's just weird. If I choose to have medications, I would prefer to have them administered through the IV, not a spinal. I cannot have them through the spinal. I would like the baby to be monitored using external monitors intermittently so that I have freedom of movement. As long as the baby and I are fine, I would prefer not to have the labor stimulated, but if I do, my first option would be to rupture the membrane. If my doctors or midwives feel that my pushing may not be progressing efficiently, I would like to be reminded that sometimes changing positions may help. I would like to be offered the following positions: squatting, side laying, semi-reclined on a bed, birthing bar, hands and knees on bed, kneeling, resting arms on bed, or semi-reclined, knees bent, heels on the bed, pulling a towel. And once again, the only option I did not choose was standing during delivery because that to me seems impossible. I don't know. I guess there are people that have done it, but that just seems like something that's not possible to me. Like, I just feel like it would not work. Ideally, I would like to avoid an episiotomy. I would like my practitioner or partner to support me by using a warm compress, massages, or encouragement to breathe with my urge to push, allowing me to move with the flow and force of my uterus. That just sounds awful. If I need an episiotomy, my preference would be to have my physician or midwife use local anesthesia. I mean, I know you're going to be in so much pain, but still the thought of somebody kind of taking a pair of scissors and just going snip, snip, snip without any kind of pain medication just doesn't sound like something I'm interested in. I understand that if I need assistance delivering the baby, that my doctor will try the safest manner possible for myself and the baby. However, if I am able to choose, I would prefer to use the vacuum over the forceps, but I do trust the judgment of my healthcare provider, so if they do decide that the forceps would be a better option, then I am okay with that. One of the options is that I would like to touch my baby's head as it crowns, and I put yes just because I don't want to not be offered that and then find out later that I would like to do that. So I can always decline that. If my doctor says, hey, do you want to touch the baby's head? I can always say, no, I really don't want to. I would like my baby to be placed on my abdomen immediately following the birth as long as my baby is crying and has a normal heart rate. I would like the opportunity to cut or have my partner cut the baby's umbilical cord. And that is something Danny is planning on doing as long as he makes it through the whole process. We've been joking with him the whole time that he's going to pass out, so which would be kind of interesting. Now on to the third stage of delivery, and this is delivering the placenta. Assuming both the baby and I are well after the delivery, I would like the opportunity to see the placenta. Once again, I just put yes because I can always decline that later. I feel like probably nobody else in the room wants to see the placenta, but I don't know. I kind of like science and I think it'd be kind of cool. So I put yes. I would like to have my additional newborn procedures thoroughly explained to us. Of course, I want to know what's happening to my baby, so anytime they do anything to the baby, I'd just like to know what's going on. I would like for my partner or myself to be present during all newborn procedures. Now on to immediate newborn care. I understand that it is routine to administer erythromycin and antibiotic ointment to the baby's eyes, and I just put that's fine to do as soon as the baby's born. I understand that it is routine to give newborns a one-time injection of vitamin K, and my option was to start it now or to wait until the baby's first checkup. I said you might as well just start it now. The baby's going to get it anyways, I might as well just do it now. I understand at some point my baby will be taken to the newborn nursery for their weight, length, and physical assessment and their first bath. I would like to have the baby taken to the nursery and bathed as soon as possible, and it is important for my partner to be present for this. I understand that immunizations will be given in the hospital. I would like to begin the immunizations while I'm in the hospital. Now there's a section on cesarean births if I were to need that. I would prefer for my partner to be present for as much as possible during the surgery. I would like to remain awake. Now, this is where it gets a little tricky because I may possibly not be able to be awake because I cannot have the epidural, so I can't have any type of spinal. However, when it comes to the C-section, being put to sleep is also kind of a risk. So I would really kind of have to take into consideration what's more risky, being put to sleep for the C-section or getting the spinal. And I have a feeling I would probably take the risk on the spinal at that point because I don't really want to miss the birth of my own child. I mean, I've gone through this for 9 months, and to miss the birth of my child would be awful. So I think that unless it's an emergency C-section where they absolutely have to put me to sleep, I would probably take my risk on the spinal. I would like to have the screen lowered so that I can see my baby being delivered. I put yes. Again, it's another one I can just decline it later. Assuming the baby is doing well, I would like the opportunity to see the baby and touch him or her as soon as possible. Well, of course, who wouldn't? I mean, why would you put no to that? That just seems kind of crazy. I would like to breastfeed my baby as soon as possible in the recovery room. I put yes. The next section is mother and baby care separation issues. So there were 3 options here, and they actually made me really sad. Like, I almost wanted to cry reading these options. The option I picked was that the infant will remain with the mother unless the nurse requires them to leave the room for, bathing or anything like that. The other option was that the baby will remain in the room but be taken to the nursery during the night. And the third option, which I think is awful, is that the baby will only be in the room during feeding. Who does that? Honestly, that just makes me sad that somebody would not want their baby in the room with them unless they're feeding it. Like, I guess I could get it if it was adoption or something like that, but if this is your baby and you wanted this baby and you planned it and you're excited to have it, why would you not want it with you? The last section is about feeding the baby. My preference is that I will try to breastfeed exclusively if I can, but I also put that I would like to see a lactation specialist about it just in case I have any extra questions. So that is all for my birth plan for right now. I might add some more to it later, but this was just the standard template for my hospital that they provided to me. I printed it out and I'm going to be putting it in my hospital bag, but also since it was done online, when I get to the hospital, they can actually pull what I wrote and read it all there. So I will make sure that they have a copy of it once I get to the hospital and make sure they look over it. If you have any questions about my birth plan or you want to make any suggestions to my birth plan, definitely leave it down below. Don't forget to thumbs up the video, subscribe to our channel, check out our daily vlogs, and find us on Facebook for even more information. I'll see you next time. Bye!